Imagine if there was a simple, non-invasive way to rejuvenate the skin, improve healing and reduce wrinkles. No needles, no downtime, just light. Red light therapy promises all of this, but does it really live up to the hype? As a doctor, I'm going to walk you through the research, show you how this works on a cellular level, and share what we know about the impact on skin health. So if you're curious about anti-aging, or you're thinking about red light and you're wondering whether this is worth the investment, I'm going to help you to separate fact from fiction and see if red light really delivers on its promises. So red light is on the electromagnetic spectrum. This is a big spectrum of waves from very long to very short wavelengths. Short wavelengths might be gamma rays, X-rays, through to radio waves. And in the middle, we have the visible light spectrum. Red light's at the longer end of the spectrum. We have waves between about 620 and 700 nanometers. And most of the devices that we have for red light therapy go from about 630 to 660. And this is an effective wavelength, but it's quite safe for the skin. So red light's really good for skin health because it penetrates about 8 to 10 millimeters into the skin, which is perfect for skin health. Shorter wavelengths like blue light don't penetrate very far, but they can be useful for killing bacteria in acne. When we go to longer wavelengths, that's infrared spectrum. This is light we can't see. It penetrates a little bit further, and this is why infrared light is good for soft tissue and musculoskeletal problems. The basic benefits of red light therapy for the skin are to increase collagen production, reduce inflammation and promote healing. So red light therapy affects the mitochondria. This is the part of the cell that produces energy. It produces energy in the form of a substance called ATP, and the more of this, the better the function of the cell. In cells, we have an enzyme called cytochrome C oxidase, and this is thought of as the power switch, but this power switch can become slightly blocked by another molecule called nitric oxide, and red light goes into the mitochondria and it kicks out the nitric oxide, and this frees up the enzyme to produce much more energy, in fact up to 16 times the amount of energy within the cell. And the nitric oxide that gets kicked out goes into the bloodstream, and we know that this has a really beneficial effect on improving and modulating blood flow within blood vessels. So when the skin cells have more energy, they function better, and that's important for skin turnover and regeneration and wound healing. Particularly important with anti-aging is the fibroblasts. These are the small cells that produce collagen and elastic fibers, and they are crucial for skin health, improving fine lines, wrinkles, skin appearance and elasticity. So we've got some good evidence for skin rejuvenation. A paper in 2013 by Lee and colleagues showed that a 12-week course of red light treatment given a few times a week led to a 35% increase in collagen density and a 19% reduction in wrinkle reduction. A year later, in 2014, Russell and colleagues did a randomized control trial. That's the best quality trial in people aged 30 to 55, and this showed that over an 8-week period, just using it twice a week, the red light, we had a 40% increase in collagen density and a 25% reduction in wrinkles. This was based not only on clinical grading, looking at photographs and objectively looking at the improvement in wrinkles, but also biopsy, so it scientifically proves that there were improvements in the skin quality. Acne can also improve significantly with red light treatment. Over a 10-week period in one study in 2020, there was a 60% reduction in the number of inflammatory lesions in the face, and patients also found that the skin seemed clearer and was less oily. And an earlier paper back in 2007, which alternated red light and blue light, which has got bactericidal properties, killing bacteria, led to a 75% reduction in the acne lesions, which is a very highly significant reduction. The benefits in acne treatment were seen only over 12 weeks, and it was important to note that the control group who weren't using the red light, they were using standard acne treatment, so the red light seemed to significantly outperform the standard acne treatment. Similar to acne, we've got some evidence for rosacea. That's a skin condition with inflammation on the face, typically with older adults. And this showed that most patients, about 71%, had more than a 50% decrease in the redness and inflammation from rosacea. There's some emerging evidence to show that red light treatment might reduce sunburn and UV radiation damage. One study showed that the half of the trial group who had the red light treatment before sun exposure had more than a quarter reduction in redness and sunburn. This suggests that it might have a preventative effect. And another study looking at people who had been sunburned showed that there was a 50% decrease in healing time in those who had red light treatment, showing the benefits of that increased energy production. What about safety and side effects? So red light treatment is usually considered pretty safe, and the trials that have been done in it have generally reported little or no side effects. Anecdotally, patients can recall some redness or transient irritation, but these effects are mild and would not be expected to last anything other than a very short period of time. Of course, common sense comes into play, and it's important not to use the red light for excessive periods, far in excess of what will be recommended by the manufacturer. When we're looking at evidence, there are some limitations. There aren't a huge amount of studies of high quality. There are different treatment protocols, there are different devices, maybe different wavelengths, and therefore it's difficult to put all this together. There are some good randomized control trials, and over time when more of these emerge, we can put them together and get a better view. So that's a little bit lacking and something that we will address in the future, I'm sure. So if you're considering purchasing a red light device, what should you look out for? What are the factors to consider? First of all, we've got the wavelength. So as mentioned before, red light is a specific wavelength. So you're looking at about 630 to 660 nanometers. That's the effective range. Some other ones outside that might be near infrared, which would be good for penetrating deeper, but might not be so good for skin indications. You might also look for one which has got a red and blue light combined if you're thinking about acne treatment. Secondly, we've got energy output. So this is typically in a range of about 10 to 40 milliwatts per centimeter squared. You can get ones with higher power, but you have to be more aware that these can cause increased skin irritation, but the treatment time might be a little less. When you're thinking about treatment time, you've also got to think about ease of use and whether the red light device is portable or hands-free, or whether you have to stay static in one position. It should be checked for appropriate standards. In the UK or EU, we have the CE marking. In the US, we have the FDA approval, and this is something that you should be aware of when you're purchasing a mask, depending on your local regulations. Cost is obviously important. We're looking anything from £50, that's $70 or so, up to more than $1,000. This might depend on whether you're buying a mask or a panel, and of course the brand. Striking a balance is important. We want to have something which is relatively cost effective, but we want to have something that's from a reputable brand that we can trust. One of the main considerations is whether to buy a panel for the home or a mask. Of course, a mask is only going to treat the face, whereas a panel can treat larger areas of the body. A panel can also deliver a higher power, which is good for larger areas of the body with a shorter treatment time, although a mask is more portable and hands-free, and a panel is going to take a lot more space in your house and is going to be much more expensive, perhaps $500 to well over $1,000 for a piece. So red light treatment does seem to have an array of benefits, which is pretty impressive considering it's relatively straightforward and easy to use. There are some great non-surgical treatments for collagen building, and also some other home treatments that can be really good. I've got a video on collagen supplements here you might want to check out after this video. So I will see you in the next one.